You're doom scrolling again, and you're not even done with your year-old questions. Let's at least prep for rounds tomorrow and break down this article. IV thrombolytics is recommended for ischemic stroke if patients present within 4.5 hours of symptoms, but up to 75% of patients present after that window. If perfusion imaging shows salvageable ischemic brain tissue, alteplase has been shown to be beneficial up to 9 hours after symptom onset. This study addressed the role of tenecteplase compared to standard medical treatment in patients with occlusion of the middle cerebral or internal carotid artery, presenting 4.5 to 24 hours after symptom onset, without access to thrombectomy if salvageable brain tissue was identified on imaging. The authors found that treatment with tenecteplase resulted in lower disability and had a higher percentage of patients that were functionally independent at 90 days. Additionally, patients had major neurologic improvement at 72 hours. There were higher rates of intracranial hemorrhage within 36 hours, however, this didn't reach statistical significance. So in summary, tenecteplase administered 4.5 to 24 hours after stroke onset in those without access to thrombectomy resulted in less disability compared to standard medical treatment. However, this study was conducted where stroke etiology was due to atherosclerosis rather than AFib, results centered around imaging, and in a population where thrombectomy was not available.